How do dentures stay in place in your mouth? Ideally, they stay in due to a suction cup effect. After you put the denture into your mouth and press it into place, it squeezes out the air that is underneath the denture and creates suction, just like when you stick a suction cup onto something. The more surface area of your gums that the denture covers, the better it should stay in place. Again, the bigger the suction cup, the stronger the suction. Now this works better in the upper jaw than in the lower jaw. If you look at an upper denture, it has more of a round shape, similar to a suction cup. That shape, along with a tight seal along the edges, enables the denture to squeeze out the air from underneath it and stay in place. The lower denture is shaped like a horseshoe and usually doesn't generate as much suction, although the flanges on the tongue side of the denture can be made to engage undercuts in the jaw to help it stay in place. The edges of the dentures need to be long enough to cover as much jawbone as possible, but they have to be comfortable to wear. The edges have to be short enough to avoid all the muscle attachment points in the mouth as well. So that's the book version of how dentures stay in place. In reality, it's a bit different. Here are some of the issues that can cause dentures to not stay in place well. The main reason that most people know about is bone loss. Without enough jawbone to support the denture, it won't stay in place well. Bone loss is also why dentures get looser over time. Denture adhesives work partially by filling in the areas where bone was lost to help replace some of the missing bone and to help create suction again. People who have lost a lot of bone under their dentures, such as in cases where they received immediate dentures, may benefit from using a pad type of denture adhesive, such as Seabond. The thickness of the pad will help fill in the space where the bone was lost better than a denture paste or cream. Flip side is if you only have a small amount of bone loss, the pad may be too thick for you to use and a paste or cream is a better choice. Another reason bone loss can make a denture loose is because without enough height of bone, the denture has nothing to grab onto. I've seen people whose lower jaws were so atrophied that the floor of their mouth was perfectly smooth from the cheek to under the tongue. In that case, their only option to have functioning lower teeth would be to get dental implants. So now that I covered the main reason why a denture won't stay in place, let's talk about some other reasons why dentures may not stay in place. The two most common reasons I see in people with relatively new dentures are overextended denture edges and overly adjusted dentures. Overextended denture edges means that the edges of the dentures are too long. The added length can cause sore spots, but if they are too long, the denture will be moved by your mouth muscles when you speak, laugh, or chew. Remember the border molding and impression visit when you had your denture made? Your dentist had you stick your tongue out, open and close your mouth, and they also pulled on your lips and cheeks. That was all to capture the border between the movable parts of your gums and cheeks and the unmovable parts on which your denture will sit on. If the denture is too long somewhere, it's usually not a big deal to fix. The denture needs to be shortened in that spot. While it might seem like a simple fix that you could do at home, please see your dentist. The denture needs to be adjusted in the proper spot. It's much easier to remove the material than to add it back. Adjusting the denture too much or in the wrong place will lead to the next issue, overly adjusted dentures. This can happen by removing too much material from the denture for a sore spot adjustment, especially if the sore spot is along the edge of the denture. If you remove too much material, it can affect the seal the denture makes with the gums. Without a proper seal, the denture won't have any suction and won't stay in place. Adjusting the denture in the wrong spot can cause this to occur too. It's easier for your dentist to find the correct sore spot if they can see the sore spot. Without a visible sore on your gums, your dentist will have to guess where the spot is, even if they use pressure indicating paste. So please try to wear your dentures as much as you can. Lastly, some people just are not good candidates for dentures. If a denture needs to be adjusted so much to be comfortable that it won't stay in place anymore, then dental implants will be a much better option. Unfortunately, most people who can't wear dentures don't know that until they try wearing dentures. If you are getting dentures for the first time, always remember that not everyone can tolerate dentures. It's not your fault, it's not your dentist's fault, it's just life.